Falling or the fear of falling should never be considered a normal process of aging. If there is a fear of falling, it can be identified and can be addressed very quickly. Some conditions that may cause an individual to be at a risk for falling could include a decrease in the flexibility of the joints, a weakness within the ankles, knees, or hips. It might also be a slower pace of walking. It could be a shorter step. It might be decreased coordination. When we are developing, we have the ability to sway 4 degrees forward, 4 degrees backward. If that sway is not available, we have certain strategies that we use. If those strategies within your legs are not available because of weakness, then you are at a risk for falls. There are certain medical conditions that do increase the risk of falling as we age. And some of those fallings that I've noticed here at Retreat Doctors Hospital would include arthritis, osteoporosis, which does bring about a decrease in posture and the greater potential of having fractures. Diabetes, which brings about peripheral neuropathies and changes within sensation as well as changes in vision. There are some conditions that could be neurological in order as well, such as diabetes or strokes. All of these could predispose an individual to having an increase in falls. There are certain extrinsic factors that do predispose an individual to falls. One of the most major causes of falls would be taking 4 or more prescribed medications. Other factors that you might find in the household could be cluttered pathways, cluttered stairwells, electric cords, water on the floor, lights that are not working, or possibly rushing to accomplish a certain task. If you are concerned that you may experience a fall, or if you're fearful that you might fall, my recommendation is to seek a physical therapist. Here at Retreat Hospital, we would be able to identify those issues that could possibly lead to a fall and develop a plan of care that would be identified specifically to you. That plan of care could include exercises, flexibility, strengthening, posture, gait. If you are fearful of having a fall, a physical therapist could help you identify that cause of a fall and develop a plan of care that could address those inadequacies or issues. That plan of care could include strengthening, mobility, range of motion, posture, balance, and possibly recommend adaptive equipment or other examples that might help you perform a task more easily. Examples of exercises that we might recommend would be a walking program, water aerobics, gardening. Dancing is an extremely good one that you could do with a friend or a family member. Tai Chi. Anything that would improve your balance, improve your endurance, and keep you active.